What are common wrist injuries in volleyball? If you play volleyball, you know how important it is to keep your body healthy. One area that often gets overlooked is the wrist. So, what are the common wrist injuries in volleyball? Let's break it down. Wrist sprains and strains are among the most frequent injuries players face. These happen when the ligaments or muscles around the wrist get stretched or torn. This can occur during dives or falls when a player lands on an outstretched hand. It is a common defensive move, but it can lead to injury if not done carefully. Another serious injury to watch out for is a wrist fracture. This involves a break in the bones of the wrist, usually from a hard fall or impact. The wrist takes the brunt of the force, which can lead to a fracture. A specific type of wrist fracture is the scaphoid fracture. This occurs in one of the 8 small bones in the wrist called the scaphoid. It often results from falling on an outstretched hand, causing the wrist to hyperextend. This injury can be tricky because it might not show up on initial X-rays, making it hard to diagnose. Tendonitis is another concern for volleyball players. Repetitive wrist movements can cause inflammation in the tendons, leading to pain and stiffness. This can affect your game, making it hard to perform at your best. Quervains tenosynovitis is a condition that can also impact volleyball players. It involves inflammation of the tendons on the thumb side of the wrist. This can cause discomfort during wrist movements, which is not ideal for a sport that relies on quick and precise hand actions. Now, how can you prevent these injuries? First, using proper technique when diving or landing is essential. This can significantly reduce the risk of wrist injuries. Additionally, wearing wrist supports during play can help stabilize the wrist and prevent excessive movement. Strengthening exercises are also beneficial. Focus on exercises that target the muscles around the wrist to build strength and resilience. If you do experience a wrist injury, immediate care is important. The RICE method, which stands for rest, ice, compression, and elevation, can help reduce swelling and pain. Understanding these common wrist injuries in volleyball is key to staying healthy and enjoying the game. By taking preventive measures and knowing how to treat injuries, you can keep your wrists in top shape and play your best.